I've been asked to answer the question of why should you go to a pain specialist as opposed to another specialty of medicine? And I think it's a good and fundamental question. So, what specialties treat pain? Just about every specialty treats pain. So, internal medicine doctors treat pain, orthopedic surgeons treat pain, neurologists treat pain, pediatricians treat pain. But why a pain specialist? Well, one reason that a person should go to a pain specialist is if the pain is affecting their life in a significant manner. Because if the pain is affecting you in a significant manner, it means the pain has taken over a part of your life. And a specialist that is not a pain specialist may look at a piece of your pain and not look at you as a full functioning human being. And that is really the mandate of the pain specialist. A pain specialist should look at that person with the goal that they want to restore quality of life and function in that person as much as they want to reduce their pain. And you won't get that by going to a non-pain specialist. In fact, you won't even get that going to an interventional pain specialist. By interventional pain specialist, I mean to say a pain specialist that is really trained to do interventions, whether they be injections or more invasive things like spinal cord stimulators or morphine pumps. They're basically, their training and their approach is procedures. That's not the kind of pain specialist I'm talking about. I myself am a physiatrist, a physical medicine rehabilitation specialist. And that specialty, I think, is the best suited to treat chronic pain conditions. Why? Because the mandate of the physiatrist or physical medicine and rehabilitation specialist is optimal function. So there are physiatrists that are stroke specialists. There are physiatrists that are musculoskeletal or amputee specialists, spinal cord injury specialists, neurodegenerative disorder specialists like MS and muscular dystrophy. In all cases, the person that the physiatrist is treating not only has a disease or an injury, but they've been physically impaired as a result of that disease or injury. And the goal of the physiatrist or physical medicine and rehabilitation specialist is to restore that function. And chronic pain is one of those subspecialties. So when you have a physiatrist that is a pain specialist, like myself, the goal is not just interventions, or shouldn't be just interventions or procedures. The goal should be functional restoration and quality of life improvement. So when a person not only has a pain condition, but it's put strain on the person's relationships, it's put a strain on their ability to sleep in a restorative manner so they feel tired during the day. They have fatigue during the day. They can't do their activities of daily living like they want to, whether it be recreational activities like sports, all the way down to dressing themselves, feeding themselves, bathing themselves, or cleaning the house. So when a person has gotten to that point where they really are having trouble functioning as a result of their pain, that is the time I think that they should look for a pain specialist.